Hello, everyone, and good morning. My name is Pothik Chatterjee, Assistant Vice President of Innovation at LifeBridge Health and Executive Sponsor of 1501 Health. Welcome to our graduation celebration today. Thank you all for coming. And thank you to everyone that is joining us virtually. 1501 Health is our joint venture between LifeBridge Health and HealthWorks CareFirst, where we identify, invest, and support the most innovative healthcare startups that we believe can truly move the needle forward during these exciting times. 1501 Health is a unique partnership bringing together the expertise of an insurance provider or payer with the expertise of our healthcare system providing direct patient care. That's where the term payvider comes from, partnering the payer and the provider to help accelerate the journey of these early stage health technology startups. Bringing our payvider perspectives to these young companies, we enable them to integrate and scale into the complex healthcare space. When we talk about 1501 Health, we often talk about the 3 C's, which are capital, customers, and community. And today's event really is all about the community. It's about being able to celebrate the accomplishments of our Cohort 1 startups who will be graduating today and welcoming the 7 new startups that have joined our program for 2022. And it's also about celebrating all of the advisors and mentors that helped this program be so beneficial and impactful over the past year, and the members of the innovation ecosystem and venture capital investors who are here to learn and appreciate the success of our startups. We hope that you will have some time today to also check out our physical space of our 1501 Health Innovation Center, including the model clinic that allows entrepreneurs to test and simulate new technologies in a clinical setting. One of our startups called Flowly has a virtual reality headset that you can demo for 5 minutes in one of our spaces as well. And this helps reduce anxiety and stress for mental health patients, as well as for opioid patients looking to reduce dependency on that medication. So lots of exciting things to check out during this event today. Now for the agenda. During the first portion of our day, we will hand over the baton between our first and second cohort at 1501 Health. We will introduce you to the new cohort and celebrate our graduating group. During the second portion, the first 5 companies from Cohort 1 will pitch their business offerings and show off all they've accomplished so far, supported by our cabinet advisory members. And I have to say, the first cohort has really set a high bar for the second cohort to follow. They've tripled their funding over the past 12 months, and we're also really proud of the diversity of our entrepreneurs. We have 75% diverse founders represented in our program, which is something that's really unique and something that we are really proud of. And we're also proud of our health equity focus that we took for the first cohort and the second cohort, shaped partly by our COVID pandemic experiences. And you'll get to hear directly today from the founders how they're making an impact in our community. An innovative program like 1501 Health is only possible with visionary leaders who are willing to think in groundbreaking ways about how to improve the future of healthcare. It is my pleasure to introduce such a leader, Neil Meltzer, President and CEO of LifeBridge Health.
Thank you, Pothik. Throw this over there. First of all, I just want to say welcome. What a tremendous accomplishment. This organization came together really as a result of a discussion that Brian Pinnock and I had about 4 years ago when we were talking about innovation in the city of Baltimore and the fact that there really wasn't a focus about innovation in healthcare. And what a great opportunity to come together, 2 organizations, to really support individuals who want to improve the health of the communities through work with both the payer and the provider. We found that there were way more ideas out there than we ever thought possible. We're tremendously supported by the community, and we are tremendously proud, frankly, of all of you in this room today. We couldn't have done it without you. We're still moving forward. This is just the beginning. It's only 4 years old. You know, our vision has always been to support the innovators and really to come up with ways to not only improve the health, but really focus on real health outcomes as opposed to just treating individuals as they're going through part of their health journey. So the programs that we've been supporting are beginning to show real value to both our local community as well as communities well beyond Baltimore City. So it's an exciting day for us. We're thrilled to be here. What I'd like to do at this point is really turn the podium over to Ricardo Johnson and Dan Blum, who've been really the leaders, the sponsors of this over the past several years. And I'm excited to hear from them and to hear from the cohorts later on this morning. So thank you.
Thank you, Neil. Good morning, everyone. My name is Ricardo Johnson. I'm the Executive Vice President for Strategy and Emerging Business at Cure First, and am, with Dan, very proud to be the executive sponsor of 1501 Health. We stand right now at a point where healthcare innovation and 1501 Health are needed more than any other time in our country's history. We continue to see soaring prices. We are just coming through a pandemic, fragmentation in our supply chain, or fractures in our supply chain, and it is amazing to see new technologies, new innovations coming forward and being implemented within the payer and provider ecosystem. But we also know that whether it's augmented reality or virtual reality or blockchain, while new technologies are interesting, new business models need to be created to actually implement these technologies. We're seeing rises in technology that, alone would be interesting, but not as impactful as the combination between those technologies and virtual and physical presence. And so one of the things through the cohorts that I'm really proud of, and the focus that we have at Care First, is the combination between the digital and virtual experience and those things that actually touch people physically and have a presence in their community. And so we are very excited for all the companies that you'll hear from today to bring them into our ecosystems and to really see them implemented with our members and our patients.
Thank you. I'm Daniel Blum. I'm president of Sinai Hospital and also Grace Medical Center, and senior vice president of LifeBridge Health. I have the privilege of working directly for Neil. And this, in many regards, is the vision of Care First and LifeBridge leadership, who came together in a way that's very unique and distinct from the usual payer-provider relationship, which can unfortunately be adversarial. And ironically, that stands in the way, that kind of a mindset stands in the way of the people that we're both trying to serve. And so this relationship, in my experience, is actually quite unique and genuine in the coming together of these two organizations and finding a significant overlap in our corporate Venn diagrams, where we can refocus on our purpose and mission and work together to help the people that we're supposed to be serving. One of the real delights is finding companies that are scrappy startups who have this ideological approach to how they can not only change healthcare or disrupt healthcare, but actually improve healthcare. Change for change's sake is not always the best course of action. Disruption can be volatile and, in fact, injurious. And so we have this common mindset about, learning from the past and our experience and, invoking change for the purpose of improvement. It's a privilege to work with and invest in companies that have a clear mindset around social responsibility. And also, as much as we bring our resources to bear, clinicians, administrators, technology experts, facility experts. We have, the hospital environment is like a mini city. So we're able to bring our subject matter experts forward and assist these startup companies. But it's also a delight to watch them interact with each other and kind of cross-pollinate their history of experience, whether it's trying to get funding or use of a technology platform or the dynamics of working with people, all of the elements that you see a startup company struggling with. And in fact, the fact of the matter is, as large established organizations, we struggle with the same things. So hopefully the combination of the two of our organizations can bring forward our experience, our good intent, support organizations that want to produce a positive change, and we look forward to seeing improvements to come with these cohorts. The true secret that Ricardo and I want to share is we are not really the direct curators of all of this. Our program managers really, on a day-to-day basis, operate this enterprise and have, in many ways, it's their kind of brain trust working together that have produced the value that we've seen so far.
In other words, Dan is saying we are affectionately called overhead. Is basically what it is.
You're a little bit more overhead than me. So we'd like to, introduce our managers and have them talk a little bit more about the program and what's in store for today. So come on up, guys.
Great. Thank you all for having us. I'm not used to being mic'd, so here we are. I'm Emily Durfee. I've met many of you, but not all of you. I co-manage 1501 Health from the Care First side.
And I'm Jordan Evans, co-manager of 1501 Health from the LifeBridge Health side. Emily and I work together very closely with these cohort companies, helping them to accelerate their businesses, helping them to integrate into the payvider space, and helping them scale there. And really, the best part of our jobs every day is supporting you guys. And we're so thankful for the work you do and how you're changing the world. We are incredibly grateful that you took a risk and a chance on us to be part of our inaugural class and really helped us build a program that delivers value to healthcare entrepreneurs.
And we're also grateful to the rest of you all in this room, right? Because with all of your support, we've been able to run, I think, really amazing support for the companies that we brought into our first cohort. And the first month and a half of our second cohort, I think we're at now. Things that 1501 has done so far, we've helped people pivot their business models. We've helped them understand where the real value that they can create in the market is. We've helped them prioritize their customers and say, we came into the program thinking that these are the 3 customers we should be looking at. We prioritized one from that list, because they are the ones with whom our incentives and goals are best aligned. We've also helped them think about how they integrate workflows, right? If they're working with providers, for example, how do they actually make sure that it is a benefit and not a burden on the providers that they are working with to be part of the program? One of the things that came really clearly through this pre- and post-program surveys that we did was also around regulatory and regulatory trends, right? I think it might have been Liz from Can Do, one of our second cohort companies, that said, I speak like 6 different languages, I've lived in different countries, I've launched 2 startups, and healthcare is the hardest language I've ever had to learn. I think we can all resonate with that, and that is why we're so grateful to bring together kind of the creativity and the innovation from these startups and the expertise of all of you in the room who have helped these folks learn that language and learn it well enough to be able to build sustainable and scalable business models into it. And then finally, we've worked with some of these companies to figure out partnerships, right? There are ways that as we've gotten to know the companies better, there have been clear value propositions where what we do and what we need overlaps with what they are able to provide. And so we've really been able to push the boundaries on some of the things and the partnerships that we've had both at Care First and at LifeBridge Health. So we're so grateful and proud of this combination of folks in the room and are so grateful to have you all here to celebrate. Which I believe brings us to the first really exciting celebration that we have, right? We brought in 5 companies in May of last year. They took a chance on us. We had never done anything before. They asked us what we were going to do, and we said, well, this is what we think we're going to do. We hope we will do it. And they took the chance anyways. We're just so excited and proud of having them as part of our cohort. So what we're going to do is we're going to call them one by one, give a quick introduction to what they do, and then congratulate them for graduating. So we will start with Even Health. So come on up. Woo! Oh. So many of you have already met Even Health. Even Health is a digital wellness program that improves access, rebuilds trust, and removes stigma from mental health. So they have a platform called Cabana that's currently serving over 70,000 healthcare workers, including folks at Sinai Hospital at LifeBridge Health. So they're one of those companies that we're so proud to have that pilot with. In their program, they moderate group classes and do training in proprietary metaverse technology. Okay, that's a mouthful. To increase psychological safety and to just generally tackle one of the biggest problems that we see in our course of our day-to-day life, which is the burnout of those who give care to the ones most in need. So just really proud to have David and Heather in our cohort. Thank you both so much. Oh.
Great.
The second company that we have, and we should pull up a chair for Andrew. Andrew's staggering. So Andrew is another one of our entrepreneurs in our first cohort. He leads Live Chair Health. Come on up. We're excited about him. So Andrew, I think the thing that he does is one of the most creative things that we have seen in the healthcare industry, and that he leverages community liaisons at scale with technology. So he works with barbershops and churches and folks that already have trust in the community to increase preventative primary care and to increase member engagement, especially in managed care organizations. We're really excited about how he's leveraging those community spaces and working on that to close the life expectancy, the gap between life expectancy and health equity for underserved populations. So thank you so much, Andrew.
Absolutely. Take a seat, please. Awesome. All right, and I would love to call up Siggy from Baby Live Advice. I've had a chance of working very closely with Siggy as she's piloting her program at Sinai, and it's just a delight to work with. So Baby Live Advice. So she's on a mission to reduce the costly complications and close gaps in maternal and infant care. They do this using a tech-enabled platform with professional providers in collaboration with health organizations, employers, and insurers. And they do this through remote education, monitoring, and support to expectant mothers. So Siggy, congratulations.
Thank you. Thank you so much.
All right, next. Tegan from Wellset. Congrats, you're doing it. So Tegan is on a mission to increase access to holistic care, so focusing on easing anxiety and promoting overall good health. They provide access to a robust schedule of live-streamed and on-demand classes led by experts in science-backed well modalities. They include a lot on their platform, including meditation, yoga, nutrition, breathwork, and many, many other.
There's a list.
See, I know, there is, so I didn't want to go all the way through it. But in their 12 months with 1501, they've made a huge pivot going from direct to consumer, and now they're offering to self-insured benefits market. So congratulations to you. All right.
Awesome. And last but certainly not least, our final company pair team could not be here in person. So you'll hear from Neil later on in the demo day. But in the meantime, so that you get a quick taste of what pair team was able to do, they are on a mission to improve well-being of underserved communities. They partner with safety net providers to move those providers into value-based care. And they extend their staff through virtual and community-based care teams. They integrate with the clinical and IT workflows to try to make sure that that is actually scalable and that they're able to provide comprehensive care management and social support for those populations. So you'll get to meet them later. They are awesome, and we're so glad to have them here. So without further, yep. They're listening. They're like on the virtual feed. So without further ado, want to bring kind of all of you front and center. Congratulations so much to our first ever cohort. You were the guinea pigs that set a very, very high bar. You taught us, and hopefully we taught you too, and we're just so grateful to have had this time with you. I think so. You'll get to hear from all of them in the demo day portion, so you'll get to know much more about their business. And I don't think you all got to see this, but just in case you were curious, they're all engraved with their logos on the back, so specialized trophies. Awesome. So that was cohort 1. They're graduated now. They're old news, you know? Now we would really love to introduce you all to our second cohort. So our second cohort joined us in mid-March. They've been with us for about 2 months now. They've gotten to know many of you in the room, and we are just so incredibly grateful to have them all as a part of the next evolution of 1501 Health.
So cohort 2, please join us up on stage. Microphone.
Microphone?
Oh.
Sorry.
There you are. We'll let them introduce themselves.
So we're actually going to start with the first one ourselves. So Lantern is dialing in. Are we going to bring them up? Great. Lantern is remote, so we're going to bring them up now. I think.
Hi, can everyone hear me?
Yes.
Amazing. Hello. Hi. We are remote because of a COVID exposure, so you can say thank you to us later. Hi, I'm Liz. I am the co-founder and CEO of Lantern. Lantern's provided step-by-step guidance and support for life before and after a death for over 150,000 people to date. So whether you're doing future planning for yourself or you're managing the loss of someone else, we have all the tools, resources, and services you need in one place for peace of mind. Recently, we actually launched a concierge service called Lantern Guide, which provides human support for all logistics after a loss. So you can imagine probate, estate sales, navigating veterans affairs, closing accounts, and beyond. Currently, we work as a benefit for insurance companies and employers like Haven Life, Snap, People Tech, and Cincinnati Life. We're so excited to take a dive into healthcare with 1501 Health. Thank you so much for having us here and looking forward to getting to know everyone more.
Woo. True hybrid world that we live in. Thanks, Liz. Awesome. So then I'm going to hand it over to the rest of the cohort 2 companies to introduce themselves.
Hi, everyone. Just a quick of hands. Has anyone ever gotten a call from their parent or grandparent asking for tech help, whether on their phone or computer? Yeah, you're not alone. 75% of all older adults have trouble and are frustrated by and afraid of their technology. And they often need someone to help set it up and teach them how to use it. I'm Zain Islam. I've been building PCs since I was in the 5th grade. I was a genius at the Apple Store for 7 years, helping thousands of older adults get confident with their technology. Now I'm head of technology and training at Can Do Tech, where we provide tech support and training specifically designed for older adults. And we combat issues such as social isolation, access to healthcare, transportation, and food. We've closed the digital access gap for thousands of older adults since 2019. We're now fully remote. It's offering our services in over 30 states. And here at Can Do, we like to say, you can do it, and we can help. Thank you.
Hi, guys. My name is Celine. I'm the founder of Flowly. And I think we all know here, pain sucks. And so Flowly is a mobile platform to help you reduce pain. The way it works is we send you a $5 VR headset and a heart rate sensor that allows us to collect your biometric data and then convert it into visualizations in VR to teach you how to manage your nervous system. We've been in RCTs backed by the NIH, where we saw an average of 46% reduction in pain, an average 40% reduction in opioid usage in just 8 weeks of intervention. We are engineers, designers, and developers from DreamWorks, Hyperloop One, Yale, and our team includes a chair of anesthesiology of University of Pittsburgh Medical Center. Thanks. Oh, we also have a demo in that room. If you guys want to come try, it's 5 minutes.
Hi, everyone. I'm Jessica Bell Vanderwall. I'm CEO and co-founder of Frame Fertility. We are a digital fertility and family building advisor. More specifically, we have a digital health platform and a clinical algorithm that basically screen for fertility risk factors early and help to navigate patients to solutions as early as possible to avoid a downstream and often costly fertility crisis. This product was built by myself and my co-founder, who's also my husband, after experiencing a fertility crisis of our own, and we're now partnering with employers and providers to offer this as a benefit and a solution to their patients. So look forward to meeting all of you.
Hi, everyone. I'm Edwina Bright, co-founder and chief product officer of Health in Her Hue. HUE stands for Heard and Understood Experiences. Our offering is a digital health platform for Black women and women of color. We're focused on improving their health outcomes in 3 ways. One is connecting them to culturally sensitive and racially concordant providers. Another is offering evidence-based content that centers their lived experiences. And then lastly, we have community support programs. Later this year, we're looking forward to piloting telehealth. We're also looking forward to introducing data-driven recommendations to the women with providers, content, et cetera. So looking forward to getting to know all of you as well.
Hi, I'm Richard Gurley, co-founder and CEO of Rise Health. Our vision is a world free from the burden of chronic disease, and our solution is a hybrid approach for type 2 diabetes, combining care in our clinics and virtually. We leverage a full team, including an endocrinologist, diabetes educator, dietitian, health coach, and behavioral health support with best-in-class technology. And we also have been open here in the Mid-Atlantic. We opened in July in DC. We opened in Baltimore in March. And we're really excited to share that we've lowered A1C by 2 points for our initial cohort of patients. And we're even more excited what's to come and grateful for all of your partnership.
Hi everyone, I'm Dom Rabin, I'm the CEO and co-founder of Exploro. I'm the odd one out, as you can probably tell, I'm from the UK. But Exploro is a patient engagement platform that uses 3D augmented reality interactive models, an artificially intelligent avatar guide, and a series of games to reduce anxiety for young patients going through medical treatment. We started with kids with cancer, partly because of my own experience. My daughter was diagnosed with cancer when she was 13. But we're building a health information platform for any patient of any age, with any condition, anywhere in the world. We're currently raising, and very happy to have a chat about that over coffee. Thanks very much.
And how about a round of applause for the whole cohort here?
Great. So, no, stay.
Oh, sorry,
We've got a few more things. Sorry. So, as you all can tell, right, we had an amazing group in this first cohort, and I think we have an equally amazing group in the second one, right? We have found folks who are, closing health gaps, whether that's because of racial disparities, age disparities, right, et cetera. We have found people who are really thinking about how to integrate new innovative technologies into healthcare in meaningful ways. However, all of these people need all of your help, right? A lot of these folks come in because some of them have some level of healthcare perspective, but in this room, right, we have probably centuries of healthcare expertise, right? Just in this physical room, not to mention all the people calling in, right? We have people who have, deep expertise in very different areas, and that's the type of support that, all of these people need. And so we're just really grateful that you have been a part of the journey of the first cohort, and that you're considering being a part of the journey of the second cohort.
And with that said, Emily and I can't do this alone, and we depend on the support of all of you. So. Kind of like Dan, Neil, and Ricardo had mentioned, the reason 1501 is such a success is because it brings together a community to help support these companies in the 12 months that they're here and help solve their specific goals. So with that said, I would love for the advisors from Cohort 1 and our new advisors for Cohort 2 to please stand so you can be recognized.
Anyone who's providing advice.
All right, you guys can be seated.
Thank you all so much, right? Between the folks up here, the folks who you just met, and you all are the backbones. We're just the facilitators in the background. So without further ado, I think it is time to welcome these folks to the 1501 Health family, yeah? Yeah? Great. Hopefully I can make this work. You want to push the button? Woo! Awesome. Great. So what we are going to do now is we'll take a few pictures, congratulate everyone, and then we'll break for a little bit of time. We'll come back here 10:15-ish, give or take. 10:25, so you've got a lot of time. Yeah. If you all, now that you have met the companies, you've learned a little bit more about what they do, please come up and say hi to them and talk about what you do and how your work might interact with theirs, and get more food. Awesome.
All right.
Thanks, everyone.
Thanks all.
Welcome back, everyone. Hello and good morning. For those just joining, my name is Pothik Chatterjee, Assistant Vice President of Innovation at LifeBridge Health and Executive Sponsor of 1501 Health. I'd first like to say thank you to everyone here for taking the time to be with us in our first demo day of 1501 Health, whether it's in this room or virtually, to learn more about the amazing solutions built by our inaugural 1501 Health cohort. Without further ado, I would like to pass this off to Brian Pennick, the President and CEO of Care First.
Thanks. So good to see you. Very excited to be here today and to see all of these smiling faces. I had an opportunity to connect with Neil for a few minutes as we transitioned, and he looked at me and he said, "Do you believe it's been 4 years since we started this conversation?" And I said, yeah, you know, it's some time has passed. We had this thing called a pandemic somewhere in between, and suddenly life took off like a rocket ship, and we just all kind of hurled ourselves into some unknown future. But it made me think a lot about relationships and partnerships and what it is that this really symbolizes in terms of what's happening, not just what's happening at Care First and at LifeBridge, but what's happening in healthcare. And what I would say is what has made this unique from the outset is a coming together around certain principles. One is that transformational change in healthcare is critically necessary to the future of healthcare in the United States. Not incremental change, not just doing a little bit better than we did before, not just something new and next, but really true transformational change and a reconceiving of what we do and how we do it. The other is that none of us individually as people, none of us individually as institutions, have all of the resources and capabilities and frankly good ideas to drive that necessary transformational change independently. We've all got ideas and perspectives, we all have resources and commitment, we're all making investments, but we're all part of a much broader ecosystem and representative group of people that ultimately use healthcare products and services. And it's critically important that we draw those voices and those perspectives and those ideas forward. Some of those things will come out of large institutions. Some of those things will come out of individual entrepreneurial endeavors and small organizations that require investment. And not just capital investment, but investment of time and energy and institutional connection into healthcare. And that's really what 1501 Health has been all about for us. The coming together of two organizations in LifeBridge and Care First with a shared perspective about what's going to propel change, necessary change, appropriate change, urgent change in healthcare, and an environment that fosters these cohorts to do that from the inside of healthcare, the inside of established healthcare. And so we've done all of that, and the group, I would ask for those of you that are part of Cohort 1, raise your hand if you wouldn't mind, right? We've done all of that in this inaugural cohort class in the midst of a pandemic and pandemic-altered reality, pandemic-altered circumstances. And the idea that we had in the beginning is not ultimately what we executed. We were flexible in our mindset and in our approach, but making sure that we were continuing to give our commitment not just of capital, but also time, energy, and support. And we could not be more proud of the group of organizations that are represented here today and the opportunity to share more broadly with this entire audience here in person as well as virtually, the products and services that have been created that we believe have a real opportunity to reshape what happens next in healthcare. So I want to thank the team at HealthWorks. I want to thank the team at Care First. I want to thank our partners at LifeBridge. And I want to give a round of applause to our Cohort 1 graduation class, and thank you and wish you all the best into the future as you continue to shift and change healthcare for the better. And with that, I'll turn it over to Emily and Jordan.
Thanks so much, Brian. And thank you all for being here. Those of you in the room and those of you who we can't see who are coming in virtually, we're really excited to run this hybrid event. I'm Emily. I'm one of the co-managers of 1501 Health.
Jordan, co-manager with Emily.
And what you can expect from today, so we'll have our 5 inaugural cohort companies come up and explain their solution. They'll give you about kind of a 6 to 8 minute long pitch, and then we'll answer your questions. We have our venture lead, Doba, here, who will be asking those questions. If you're a VC, please submit them over the Zoom link, and he'll be going through those and selecting them and asking the questions of the companies. Doba, do you want to introduce yourself?
Sure thing. Thank you both. Hey, everyone. Doba Parushev. It's very nice to be here today. I'm part of HealthWorks Ventures. I run our growth stage investments, so I've had the privilege of working with many of you in this room. Actually, the true privilege has been being part of the 1501 Health journey from day one as an advisor and as a small participant in the selection of both the first and the second cohort. I can't wait for all of you to see what they have in store today. I've been looking forward to this demo day. But my day job is fairly simple. I am a venture capitalist. I invest in healthcare companies. And as such, I'm just going to serve as a voice for all the other VCs, both in the room and virtually today. To make this simple, as you listen to the pitches of our awesome companies, if you have questions or follow-ons, please leave them in the chat. I'm fully logged into Zoom. I'm going to curate them from the sidelines. And as soon as they're over, I'm going to throw them a couple of curveballs. So with that, excited to be here, everyone, and let's get it started.
Let's do it.
All right.
Awesome. So first, we are incredibly excited to welcome David from Even Health. He has been a great partner, and we have piloted some work with his solution, so he'll tell you more about Even Health.
Thank you, Emily. Good morning, everyone. My name is David Black. I am the CEO and co-founder of Even Health. I'm joined by my co-founder, Heather Townsend, here over on the left. We are a mental health technology company that's focused on solving the practical and the psychological barriers to seeking support in mental health care today. Our flagship product is called Cabana. That's what I'm going to talk to you about today. We're serving the healthcare professional community by an employer-provided product that creates anonymous, professionally moderated virtual group support. And I'll talk to you about the technology here, but my background is 17 years in healthcare. I've worked on the delivery side, I've worked on the provider side and payer side. And I see an opportunity for innovation in reaching people further or earlier on the mental health continuum. The number that drives us every single day is the fact that it takes 11 years on average for individuals to seek support from a mental health professional from when they first experience symptoms. We talk about time to be seen being 28 days, and that's bad, 11 years. So when you look at a study like this, I dig into what's driving that. The practical reality is we all view that our problems are small, that we can handle them on our own, that they're not big enough. We've put mental health on a pedestal, and we've made it inaccessible just by virtue of our own self-classification of it. So mental health needs an overhaul. And I like to think of the starfish story. I assume folks know this starfish story. Storm washes thousands of starfish on the beach, and a child runs up and grabs a starfish and chucks it back in the water, gets it back to the ocean, and then goes to another one, and people say, "You're not going to save them all." They say, "I can save this one." It's a reactive model. We're reacting to all these starfish, this demand that's washed up on a beach. And if we're going to solve a problem like 11 years to be seen, to say that I need help, we can't just add more people on the beach, throw in starfish back in the water. We've got to step back, change our focus, and think about how are we making the ocean bigger? How are we actually getting people not arriving on the beach, but investing earlier in mental health, and what's keeping them from doing that? And so we're focused on 3 big problems that stop people from seeking care. Access, we know that access is a problem. We know that mental health care is not a one and done like your annual PCP or dental checkup. When you have challenges, you need repeat conversations, and that's expensive. I just think dollar signs as a consumer of every interaction, that stops me. Then there's stigma, and stigma means so many things. It's the self-reliant culture. It's the fear of retaliation. Will I lose my license? And it's the shame. What do my coworkers think? And if I say that I'm struggling? There's also trust. To be able to extract what was going on in our head and communicate that to someone else requires that we trust our own knowledge of what we're experiencing and that we trust someone else. And there's vulnerability there. So these are keeping people from engaging, and it's what Cabana is about. We focus on making a hyper-accessible format for group support by connecting you with people like you, by doing it by using technology that is virtually designed to make you feel more comfortable. Zoom was not built for a natural interaction. Just putting a camera on an interaction and thinking that it's virtual care is the brick cell phone in terms of stage of virtual care. We have an opportunity to use virtual to actually mean something and prime the environment and space. And so we're breaking down all of those barriers of access to help individuals flourish. Those 11 years that people are waiting, they're in a meh state. My problem's not big enough. I'm not living my best life, but I'm surviving. And we hear about thriving versus surviving, and there's a lot of science behind this concept of, are you languishing or are you flourishing? And what we know is that if you invest in emotional well-being, in social well-being, and in psychological well-being, that you can move people up to what we call a flourishing state. And this is independent of a DSM-5 level diagnosis. If you can move people up to flourishing, you can have a lower cost of care, you can have a longer mortality, you can be resistant to depressive episodes, and you can even miss fewer work days. This is where we're solving 5 out of 5 employees, not the 1 out of 5 that are dealing with mental health symptoms or mental health challenges. So we're helping employees flourish and focusing on the healthcare population. And we're doing that because it is a large group of people that have just gone through the front lines of pandemic, that are prior to pandemics were predisposed to developing mental health illnesses and predisposed to not getting support. It is a culture of helping others before you help yourselves. So we're starting with one of the toughest populations to engage, and we're doing it. We're doing it because we've created psychological safety. We know that if you put people and you make them feel that they're in a shared virtual space, they're more collaborative and they're more cooperative. If you make them show that they're in separate spaces, they negotiate more differently, more competitively. But you put them in the shared space, they collaborate. You take camera off and you increase self-disclosure. You also reduce Zoom fatigue. 1/3 of us stare at our own image 50% of the time on virtual calls. Try to focus when you're checking out if your hair looks right or if you're coming off appropriate on camera. I mean, it is distracting. So how much of your time are you really paying attention to the discussion that's being had, to what people are saying? You turn the camera off, you lose a sense, and you increase your aptitude in other senses. So we're doing that today with 70,000 healthcare professionals. We're rolling this out as an enterprise solution. My background is supporting enterprises, so I know the challenges there, but we're already seeing utilization 2 to 10 times the EAP utilization. Most hospitals have their own EAPs. We're not getting rid of that. That provides a valuable service, but we're not engaging people early enough. So we build a bridge for trust. We engage people. And then when that higher level acuity is there, you kind of rise up to when you realize the need requires higher level, higher acuity support, you have an easy path there. You're not learning about it for the first time. We did a pilot with nursing leaders. Because we focused on nursing leaders, we felt if you can help those that support others, you can have downstream impacts. And so we did a pilot with nursing leaders. We taught them group classes anonymously, where skills on how do you deal with some of the difficult challenges there. We taught them emotional intelligence. We taught them empathy, and we taught them coaching skills. How do you use coaching to help your staff? And what we found was that people had, through just a limited number of interactions, profound transformation change. A person in their mid-40s said, I'm embarrassed to say I'm in my mid-40s, and I just made the connection that my emotions influence my actions. And I'm a different leader now because of this program. We also saw it in the data. So mental health scores across the overall population increased by 18%, 30% increase in social well-being, how you communicate with others. And then the population here in the red, flourishing. 43% of people were in a languishing state when they entered our program. No one finished the program in that state. In fact, we flipped the population to a flourishing state. 57% of people in flourishing. That's thriving. That's prepared to take on the next challenge because stress is going to be there. We're also getting traction with our employees. So we've seen our user accounts double in the past 90 days because this is a word-of-mouth solution. It takes time to build trust in mental health care, but it is so critical. You can't start with high-performing teams without trust. You can't start with trust without vulnerability. And this is a space for people to feel vulnerable. All eyes are not on you, but you're with people that are like you. You don't have to explain what it's like to walk in your shoes because everyone there wears the same shoes. People feel better after every Cabana session. And this quote here, therapy is expensive, and it should be. It's a high level of care. But sometimes we can engage people through appropriate care by connecting them with others, and that's free. So we're focused on creating a new mechanism for which folks engage in their care. Support in 30 minutes. People like you in privacy you control. We're having incredible traction already. LifeBridge is one of our 6 health systems. We're just now bringing on Mississippi Veterans Affairs Association. So we're starting to support the military community. That's where we actually got our backing. And so imagine a world where you're stressed out today and your social support circle doesn't include someone that you can talk to about a particular issue. You can log into Cabana and see a group of live discussions that are happening today or in 30 minutes with people that are like you. And we can filter it so you can find that person that has a similar background but still control your privacy. So we're excited to continue growing. We're about a month out from working with venture capital partners to do a raise. So I'd welcome any conversations, the opportunity to start a relationship. If you're a health system and you're looking for innovative ways to engage your staff and build a bridge of trust, please give us a call. Thank you.
And to get you started on the venture capital raise, first curveball, I will paraphrase this one. It seems like the core of the business today is around providing virtual group support. Do you believe that's the core solution there, or do you need to build more around it to be successful in the long run?
Yeah, virtual group support isn't for everyone from day one. So we've built a lot of asynchronous content, a lot of guided meditations. We have a VR room where folks can pick their location and pick their meditation and go and relax. Because sometimes just to break the stress cycle on a day-to-day basis is you need 2 minutes of meditation and not TikTok. So we've built those solutions to engage people. But once you need that extra level of support, we're building other solutions. We've done coaching as a pilot. So we're working with actually 60 nurses through another health system to do coaching for them. We have partnered with an EAP to provide direct psychological support. So some organizations, most have their own EAP system, and we integrate with that, but others want greater levels of support. So we have those capabilities.
Perfect. Thank you very much.
Thank you. Great. Next up.
All right. Round of applause for you.
Woo!
All right, so next up, we're excited to support Pear Team, a company improving the health of our most underserved populations by empowering safety net providers. So talking to you today will be Neil, and he'll be calling in from New York.
Hey, everybody. Nice to see some familiar faces out there. Sorry we can't be there. I'll just share my screen. Alrighty. Hey everyone, my name is Neil.
This is Cassie. Nice to see everyone.
And we're the co-founders of Pear Team, connecting underserved communities to high quality care. Federal and state governments are desperate to control a continuously growing Medicaid budget and are putting considerable regulatory pressure on plans to shift providers to value. The problem is that the challenge that safety net providers do not have sufficient resources with staffing shortages to adapt their workflows to manage risk. But at the same time, you're seeing billion-dollar markets being created overnight. In California, for example, a 5-year, $6 billion program just started earlier this year. And to top it all off, the highest need Medicaid patients do not have time for traditional healthcare, spending hundreds of millions of dollars on avoidable hospital visits. Pear Team partners with safety net providers like federally qualified health centers to provide wraparound operations, technology, and value-based contracting. We provide a care team of local community health workers, virtual clinicians that all act as an extension of the clinic staff and are powered on our AI-driven operational platform. The model is simple. We partner with Medicaid managed care organizations to help them meet compliance and regulatory guidelines, and in turn, broker value-based contracts with providers creating a much needed income stream for their practice. Our care model has received a 91% patient satisfaction, increased quality scores by more than 40%, and this year we are estimating a 31% reduction in ED utilization. Our go-to-market focuses on California, working with high social, clinical, and mental health needs patients. We're contracted with the third largest Medicaid managed care organization in the state and are so early to market that we are now the first care program that's being implemented in the Inland Empire region. We are estimated $100,000 in MRR by the end of the year and have an immediate provider pipeline that is estimated to be about $7 million in annual contract value. Now, with our model of care, the longer we work in a geography and the denser we are, the more effective we are at delivering care, leading to very attractive economics of about 20 to 25% gross margin. As a product, we scale access to care through our hybrid boots on the ground and remote care model, all coordinated by our operational platform. We interoperate deeply with the EMRs of our provider partners to coordinate in-person care. Our virtual clinicians are available 24/7 as health coaches to our high needs patients. And we set up partnerships with community organizations such as hospitals and shelters to build local referral channels into our care program. All of this is made possible by a deep focus on data and interoperability. In fact, early investments in something called robotic process automation has allowed us to work with any IT system, regardless of if there's a structured API like HL7 or FHIR. And lastly, this is all just the start on our ramp to risk. By entering the market with the 5% of the highest utilizer Medicaid patients that are accountable for 50% of the Medicaid spend, we are setting our foundation to manage risk and reduce total cost of care through avoidable emergency department use. It's estimated that about 85% of ED usage in Medicaid populations is avoidable, either being treated at a more appropriate site of care at home, virtually, at an urgent care or primary care setting, or doesn't require a visit at all. Some folks like to go to the ED purely to get a meal or because of a mental health challenge, and that's where we can step in to support. This is a very personal mission for Cassie and myself. We are building a world-class team to bring it to life. Cassie and I met at Forward, building a national network of tech-enabled primary care practices, and are taking these learnings and experience towards marginalized communities and the clinicians they serve. Todd Anderson, our Chief Product Officer, started at Honor as employee number 20 and eventually ran product as the company matured into a $2 billion tech-enabled home health agency. Our head of sales in the California market, Victor Madero, was a former managed care executive and expanded an IPA from 100,000 to 400,000 patients in the community, as well as was the chief health plan officer at the second largest FQHC organization in the country. And then our advisory team is spearheaded by Dr. Andrea Scofsey, a former chief medical officer of Medicaid under Obama. The 2010s was the decade of Medicare innovation, with the spread of models like Medicare Advantage and Medicare Shared Savings programs. And we know that the 2020s is going to be the decade of Medicaid innovation. And while the financial mechanisms are similar, the underlying care required for these patients is drastically different. And we here at Pear Team are paving the way. Thank you so much.
Let's see if the hybrid works. Thank you so much, team. First question would be, as you think about the broader applicability around the US, you're starting in California, which makes sense. But how's the scale, and how do you think about other states beyond that?
Yeah, we think about the regulatory wedge that comes from these compliance pressures. So if you look at things like this, just look at history of things like the TCPA, where health plans can then market out to health plans. Part of that started in California. It turned out to be a good idea to get patients in preventative care and increase access over text. And now you see those same legislations get copied and pasted across states nationally. There are several companies like Consejo Sanjo, or now known as Same Sky Health, that use that playbook to scale nationally.
Wonderful. And since you mentioned other companies, a competitive question. You come from Forward, there's other primary care delivery platforms out there. How do you think you're going to beat them?
Well, when you're thinking about vulnerable communities, like the ones that we serve in Medicaid, the care model requires a very different approach. So when thinking about, coordinating a referral to specialty networks, these communities require a different approach. You have to be able to offer social supports like, coordinating transportation or housing supports, or, being able to refer them over to a food pantry, and being able to do that on a care team offered by people with the same lived experiences. So really thinking about the deeper, more meaningful things that build trust within this community.
Wonderful. Thank you both. And thank you for joining us.
Thank you.
Thank you all so much.
Great. Well, thank you so much to the Pear Team. And now we're really excited to welcome Andrew from Live Chair Health. I can help.
I may stand up, but let's see.
Andrew is braving it out with some knee issues at the moment.
Well, it's good to be in a place where there's probably some physicians here, so if I get injured, I'm gonna pause the pitch and get some service. Let's take this off so I don't look.
You look so professional
yes,
now.
Yeah, okay. All right.
Awesome.
Do the clicker. There you go. All right, well, it's good to see familiar faces. My name is Andrew Selgs. I am the co-founder and CEO of Live Chair Health. Just to give people context on Live Chair Health, we began as a scheduling and payment processing app primarily for barbershops and hair salons before I personally experienced a pivotal point in my life where my dad's health began to decline as our business was growing. And so I wanted to do something about it to address the health disparities and access, influence, and reach people where they lived, worked, and played. And so we started off in barbershops. We've since expanded beyond the shop, which you'll hear today. And this mission is personal to me because the catalyst to start the business and pivot into healthcare actually ended in my dad's early death from congestive heart failure at the age of 56. So that's 20 years shorter than the average life expectancy for an African-American man. And because of our model, we're now able to access, influence, and reach people to look like my father so that they can have an expanded life. So the problem, I think most people in this room understand the problem, specifically for minorities. And we focus our beachhead customers really in the managed care space. Managed care organizations is where we find our sweet spot. But there are several reasons that minorities have challenges with their health, specifically on Medicaid. One thing we found is outdated contact information. So because of the outdated contact information, a lot of the community outreach modalities that health plans use are fruitless because of the outdated contact information. Also, SDOH issues, so social determinants of health, really is a huge lever in terms of some of the outcomes that you see, the negative outcomes that you see on this screen. And so what's the solution? So because of my experience and my team's experience building a scheduling and payment processing app, we were able to pick up a ton of cultural knowledge that we're now productizing and also leveraging technology. So we call our model high tech, high touch, because actually Pear Team alluded to this. You have to take a really omni-channel approach to engaging people in the Medicaid community. So how does this work? So literally, we set up grooming hubs, so that consists of barbershops, salons, nail salons, et cetera, and then non-grooming hubs. So we've expanded to work with housing developments, YMCAs, churches, et cetera, to reach, access, and influence this population. So at the event, we have our team on staff. We have our medical team on staff. Typically, that's a medical assistant, or we partner with LifeBridge Health on a lot of our events to actually bring practitioners there to do screenings. And from the screening, we then have the patron complete a health risk assessment, collect that data, and then our technology creates this custom health journey. So it creates this custom health journey that leads to specific HEDIS and quality gaps being closed for the plans that we work with, all through the platform and also through our customers service representatives. And really, where we are valuable is the activation, right? So after collecting that data, having the health risk assessment, then following up with the member to make sure they're activating their health journey in terms of getting connected with a primary care provider, or maybe it's an annual eye exam if someone's a diabetic. Really, we can be modular in terms of the outreach that we do based on the directives from the health plan that we work with. And what's in it for the community hub? So for grooming professionals, there's financial incentives. So that's one of the reasons they work with us. Also, good PR. And good PR typically leads to increased clientele. And so we're actually using these grooming hubs as reward centers to allow us to scale and not have to have so much boots on the ground infrastructure to leverage technology and also digital marketing. And then also for the community members and the plan members, we have tantalizing specific rewards that are culturally relevant. So it's just not a Panera Bread gift card, which, and if you know anything about Phase 2 Barbershop, it's on Pennsylvania North. It's a very challenging environment and zip code. So we want to give rewards that are specific to the community that are going to be leveraged, like a haircut or like gift cards to local food services. And this is the high tech. So this is the high-tech aspect of the model, where we leverage the technology. And one of the things that we've learned is we didn't build a mobile app, we built a web app, because the accessibility on mobile is actually a lot harder and challenging, because Medicaid populations typically don't have space on their phone, or they have low data, et cetera, et cetera. So building a web app has provided a lot of fruitfulness for us thus far. And then also we're focused on doing community engagement each month that is specific to the health plan initiatives. So as you see on this screen, the topic of the month could be Suicide Prevention Month. Next month in June, we're actually doing a huge campaign around men's health. And so each month has a theme to drive specific engagement for the customers that we work with in terms of whatever that HEDIS gap or gap closure is. And so, in short, or in sum, LiveShare Health is outsourced community engagement for health plans and health systems that allow them to close HEDIS gaps and gaps in care. We're also providing a greater member experience for their patients and members. And with that, I'll just kind of go through a couple of kind of our impact and some data. So just not part of the pitch, but just wanted to show some data. Over 2,000 individuals engaged, and we've specifically we started in the Northwest Baltimore area. We've since expanded to PG County, so these numbers are actually a lot higher. PG County, Montgomery County, Prince George's County, and recently we got a contract for Louisiana, so we'll be rolling out Louisiana, and then also in Los Angeles. So we're expanding beyond the Maryland market. Some of the interesting data from Maryland specifically, I think the state average for Maryland is 6% of people that don't have health insurance. We're seeing almost double that or over double that. So there's a lot of opportunity for us to get people connected to health insurance, which is the start of their health journey, right? Because you can't access health care if you don't have health insurance. Well, typically people do access health care, it's just in the ED, right? So we want to get these people insured, and so that they can properly go through our health journey, just like most of us in this room. Some of our engagement statistics, 30% of PCP visits attended. I mean, that's a really high percentage given the metrics that we see from some of our health plans. I was literally speaking to a health plan in Tennessee on Friday, and their PCP engagement rate for their clinics is 13%, which means that 87% of those folks that are on their patient panel are getting care outside of the primary care delivery, and we know what that leads to in terms of utilization and cost when care is in urgent care or even in the ED, right? We want to use the ED in urgent care, but use it when it's appropriate. And some of the learnings, so one of the things that we're learning because of the pilot that we have with LifeBridge Health, and then also with one of our first customers, Anthem, is the ability to share data, which allows us to be more targeted and specific around the activities that we need to execute. And then also the provider collaboration. So we've recently started working with some primary care practices to engage from the clinic and have these patient appreciation days on site, which have been pretty successful. Just a couple of testimonials from a few members. Really kind of tugs at my heart because these aren't just quotes. These are real humans that we've helped because of our model to better care. Some of our community partners, just a couple of testimonials. And with that said, I'll stop palavering and take some questions.
Sit down, actually.
Andrew, thank you so much.
Thank
And I really love the pitch is over. Let me brag for a second.
Okay.
Just one logistical question. I somehow managed to mute the feed line. If you can unmute it for the people on the Zoom, that would be much appreciated. With that, let me just pull up the questions. All right, an active chat. So first one, purely pragmatically, which markets are you in today, and how do you think about entering new markets?
Yeah, so currently we're live, obviously, in Maryland, specifically in those 4 counties that I mentioned. Louisiana will be rolling out in July, August timeframe, and also we're live in Los Angeles. So we're live in Los Angeles for the health system. We're starting to work with some MCOs, managed care organizations on the West Coast, and then Care First. We're working on some opportunities in Maryland, but also in the DC market as well. And that's just where we are now in terms of our pipeline. We probably could roll out in like 10 states if we raise more capital, but we want to be more methodical and thoughtful about how we go to market. But those are the markets that we're live in right now.
Fantastic. And similarly, on the competitive landscape, there's a number of people trying to solve that difficult to engage population problem. How do you think that you're different, you're special, you can get things better?
That's a great question. One of the things that we benefited from is like the initial model of starting the barbershops and the hair salons wasn't a new concept. A lot of these initiatives are university and grant funded, philanthropic funded. But the thing with those projects is once the money dwindles and people move on to whatever the other pet project is, and the impact or the people in the community are just left hanging, right? And so I think our model, having a business model behind our model allows us to have more impact. And because of the learnings that we've gleaned from that business model in the barbershop and hair salon space, we've now implemented it across other community hubs like housing developments, like YMCA. So our reach is broader than just people that are doing specific barbershop and hair salon initiatives. So that's how I would answer. And also technology, right? So a lot of community-based organizations and this could be changing, but the infrastructure on the back end to do a lot of the heavy lifting is something that I think we have a kind of first mover advantage in terms of what we're doing. That's why we fundamentally look at ourselves as outsourced community engagement.
Wonderful. Makes perfect sense, and thank you so much.
Thank you.
Let me take that clicker from you. Right. Thank you, Andrew. Next up, we're inviting Baby Live Advice. I'm going to hand the mic over to the always energetic and amazing Siggy.
Thank you, everybody. Thank you so much. My name is Siggy Marmerstein. I'm the CEO and founder of Baby Live Advice, which is an integrated telehealth solution that improves maternal and infant health outcomes. In my background, I'm a nurse practitioner and been working in the California healthcare for 30 years, in mainline for many years as a nurse. And then in the last 14 years, I've been a telehealth consultant to very large health organizations, Kaiser, VA, Mercy Hospital, and others as well. I started a total of 85 telehealth programs, but this one is the one that breaks my heart. So 2.2 million moms are living in maternity deserts in the United States. That means that they do not access care in a timely manner or cannot get care at all. So from this, there it is. What is going on in our country with maternity? Why is it so complicated? There are many challenges in maternity care. Most of this data is coming actually from Blue Cross and Blue Shield, with showing that moms are not accessing care in the first trimester in pregnancy 33% of the time, putting them in very high risk for preterm labors and complications. Those complications on those preterm labor and the increased care access gaps actually is bringing the total bill to $32 billion a year. That with care provider burnout of all-time high, showing that providers who are caring for those moms, OBGYNs specifically and GYNs, are burnout due to time pressure, chaos, more patients to see than they ever seen before. Those mothers are sicker, they require more care, they have mental health issues or other issues as well. They're more complicated. That demands more time of the providers, increasing their stress and their burnout. What we do is we support both mom and baby and bridging the gap into the provider, reducing ultimately the outcomes that bring moms and baby into risk. What does that really look like? So Baby Life Advice is an easy-to-access care technology with a service. The service provided by doulas, nurse practitioners, lactation consultants, mental health providers, social workers, diabetic educators, nurses, and many other providers on our integrated telehealth solution that is both web RTC, that means that you can access it through the web, as well as a SaaS solution through an app. We also provide telemonitoring services that supports the providers getting some data about those moms all throughout their pregnancy, and we care for babies all the way to 1 year of age. So we are one solution from preconception to early childhood on one integrated system. Our solutions, both shown in here, are both providing live height care touch coordination as well as I said, telemonitoring. The telemonitoring is deployed for moms who have hypertensive, diabetic, or obese in pregnancy. Those are the 3 big risk factors. This data then is integrated into an easy app, so any application to any health system that have, we will white label it on their logo. As you can see in here, Baby Life Advice will be one of the services on that application, and we will be the one who are caring for the mom on our platform. We have a full-blown EMR that will then integrate into the patient EMR. This is one of our SOAP notes. Just you can see the kind of SOAP notes that we are providing, very copious, a lot of data. We spend 60 minutes with each one of our moms. We really get to know her, find out what's going on with her, what she needs. We then bill and code every one of our visits, and we provide much education for our mothers. In a care continuum system, Baby Life Advice is really just a complementary care. What we really do is we're part of the care team. We don't silo the mom further away from her medical home. We actually improve the medical home she is in. If you think about it, from the mom gets pregnant, she comes in for her first perinatal appointment. This is the time she's being introduced to Baby Life Advice. We are then serving the mom, providing her with education, support, advice, diabetic education, hypertension care. We do her telemonitoring in her classes, and then the SOAP note goes into the patient chart. When she comes into her medical appointment, her provider is already very informed and knows exactly what to do. And as she delivers her baby, a warm handoff from the hospital for the 4th trimester care is where we come in again. We reduce by that the need for the moms to run around between different providers to get care in different places, and then the baby is cared for until 1 year of age. In our case studies, you can see that we have served many health systems and cares for baby. In total, 40,000 moms have been cared for by Baby Life Advice till today. Moms and babies, let me say that. We provide maternity education, perinatal maternity education. Sinai Hospital just signed up for that. We're doing pretty good with that. We're showing that when we provide maternal education virtually, we're showing a very high engagement rate of 76% of the moms will come to those classes. We also seen that the virtual lactation support that we provide our hospital are increasing exclusive breastfeeding for 6 months by 62%. Other wonderful data that we're showing is our postnatal follow-up is reducing readmission by 33%. Coming to dollars really is about $14 to $56 ROI for every $1 spent on our program. Other case study data that we have are showing that most of our patients are actually language speakers. We have a translation services to 250 languages, including the sign language. We're actually caring right now for about 40 deaf mothers through our sign language translation. Our visits adherence is at 68% with 99% satisfaction, and our month-to-month engagement with our moms at 15 months in general to 78%. We reduce C-section by 33% for our population. We definitely reduce readmission. As I said, improved breastfeeding, and our mental health scores are 27% lower than moms who are not cared by Baby Life Advice. Why use Baby Life Advice? Well, there's a lot of economic, operational, and of course strategic reasons to do that. On the economic side, reduces the ER, reduces C-section, and of course reducing costs. On the operational, reducing the burnout of the providers, the nurses, and all the people who are caring for those moms, and ultimately optimizing their time when they are taking care of moms and baby. And strategically, of course, parents do prefer this. to any other modality of care. This is a differentiation, and that's why health systems use us. Baby Love Advice to date is serving 5 large health systems and 14 FQHCs. We're actually doing a lot of work in the low socioeconomic rural mothers and we have some really great, wonderful clinical studies that show our outcomes every time. We just joined with the National Black Doula Association. We have 350 Black doulas who are going to be deployed in our services to help moms all over the United States. And then, as I said, satisfaction is pretty great. I'll stop there and see if there's any questions that anybody wants to ask. But before that, I want to thank LifeBridge Health, CareFirst, and XWorks for taking on maternity as one of the companies that you guys can in. As you know, this is a huge crisis in our country, and I appreciate that. I also want to thank all of my advisors in this program. Without you guys, we probably would have seen the 600% growth that we just experienced this year. Thank you guys very, very much. Thank you, Dana.
Thank you very much, Siggy.
Thank you.
So I'll start with one pragmatic question. It's let me paraphrase this. So it's unusual to see both services and telemedicine bundled in the same solution. Can you give us some more practical examples of what do those service hours look like? What do people usually ask about or talk about? What do you talk to people today?
Well, today is about formula. So biggest crisis in the world right now, formula. So we have over 400 consultations this week alone about formula and the lack thereof. Our moms who are on week traditionally are getting a voucher to go and buy formula, and those are not available for them. We are trying to find solutions for mom, giving them the right advice so they don't make their own formulas at home and unfortunately can really hurt their babies.
Got it. And then a technology question. You mentioned about the EHR interoperability and how the notes are readily available. How do you think about that? How much of a challenge is it today to make sure that that interoperability works?
Well, we already have an integration with Cerner, Epic, Allscripts, and the large 5s, so we do well there. Everything else is a PDF file drop that we can actually share with the providers. It's working really well, and providers are really excited to have that information. We actually been told you have too much information. You're telling us too much, but it's information, and that information can really save lives. So we're happy to do that.
Perfect. Really appreciate you.
Thank you so much. Thank you so much, you guys. Thank you, everybody.
Thank you so much, Siggy. Last but certainly not least, we have Tegan from WellSet here to explain all about her solution.
All right, thank you. Thank you so much. I was told not to wax poetic about 1501, so I won't, but thank you so much for all of the opportunities and everything that you've given to all of us in this past year. It's been incredible. So moving on to WellSet. My name is Tegan Bukowski. I'm the CEO and co-founder of WellSet. We are a holistic solution to burnout and anxiety. We are pretty unique, I think, in the payer-provider space specifically. We started as a direct-to-consumer company, and 1501 helped us actually make the transition over. It's been great. So statistically, most people in your company have stress. And as a result of the pandemic and working from home, most people are also burned out. 75% of employees don't think that their employers care about their mental and emotional health. This is a real problem for employers. Unaddressed stress and anxiety leads to burnout, retention issues, absenteeism, and performance problems. Also, anxiety and burnout are related to a number of behavioral health issues, including increased alcohol consumption. The pandemic certainly didn't help. Prior to the pandemic, about 10.8% of people reported having clinical anxiety disorder symptoms. And post-pandemic, that number has jumped to over 30%. And those are just the people who are talking about it. As we've heard earlier, there's a lot of stigma around talking about it, so the number is quite a bit higher than that. And also, surprisingly, anxiety is one of the most expensive comorbidities that there is. Just for example, a cancer patient who's being treated who has a comorbidity of anxiety is about 271% more expensive to treat than one without. So, meet WellSet. WellSet is the first employee well-being benefit that actually delivers happiness by working to reduce stress and anxiety. And it really works. Our data shows that 9 out of 10 people who are WellSet members feel less anxiety, burnout, and more calm in their day-to-day lives as a result of being a WellSet member. They also feel like their employers care more about them. So let's jump into what our content is. We have a lot of content, as we were joking about earlier. We are a well-being platform. We consider ourselves a mind, body, emotional health platform. And we consider our content to be in 3 different categories: mindfulness and mindset, holistic health education, and movement and stretching. Mindfulness is definitely a cornerstone of our content. It's also a cornerstone of emotional and mental health. We have all sorts of different classes for mindfulness and mindset. Some of the different modalities that we have listed in our classes are meditation, holistic therapy, tapping, EFT, hypnotherapy, breath work, and a host of others. We're not a fitness company, but we will help you get moving. So we have yoga, stretching, posture classes, as well as classes like myofascial release, somatic movement. Some of these things you may have never heard of. I would challenge you to come and try a class. They're absolutely incredible. I have sciatica, and I went to a myofascial release class a few weeks ago in WellSet. That was the only thing that has ever helped me, other than like some extreme chiropractic. And we also have holistic health education. So that might look like a Harvard MD talking to you about how what you eat affects your anxiety levels or your thyroid levels. And we also have health coaches that will speak to the group, nutritionists and dietitians. And we also have traditional medicine, so traditional Chinese medicine as well as Ayurveda. One of the strengths of WellSet is that when employers are looking at different point solutions for holistic health, which there are some cropping up, they have to get a point solution for yoga, a point solution for meditation. We have all these modalities under one roof. So we'll get into kind of the format of our content, but we have over 8 hours of live content every day where you can interact with practitioners in over 20 different modalities. So our format is 8 hours per day of live classes. Our live streamed class format is extremely important to engaging community. People feel like they're going to class when they come to class. It's really important to actually, we have guided walking classes and guided runs, and having a person actually need to put their shoes on because the guided walk is about to happen in 5 minutes can get somebody out the door when they maybe wouldn't have ever gotten off of the couch otherwise. Same with our yoga classes, same with our meditation classes. People feel like they have community, they feel connection. We've had people during the pandemic tell us that they didn't have FaceTime with anybody in weeks, and they felt like completely disconnected from their bodies. They'd just been watching Netflix for weeks, and coming to class made them feel like they had someone, they had somewhere to go, they had somewhere to be. We also have classes on demand with thousands of classes in our on-demand library. And we really mean it when we say that WellSet is for everyone. So this is something that's really important for us. We are a almost completely female-led company. We have a majority female investors, and actually I think that just changed because we just closed a round of investment, so I can't say that anymore. But anyway, we used to have a majority female investors, board members, as well as employees. We also have more than 50% of our instructors from diverse backgrounds. We have native Spanish-speaking instructors and core team members. We have LGBTQI-focused content, and we also have custom tracks for beginners so that nobody feels like they're overwhelmed by maybe something that they've never heard of before. We don't have to go into this too much, but it's a highly scalable model, really high margins. And we have a sales agreement with CareFirst as a result of our being in 1501, which is incredible, as well as a number of different broker relationships and academies that we've been involved in. Membership starts at just 75 cents PEPM, which is extraordinarily affordable for this level of care. Just to give you a reference point, our direct-to-consumer price point is $79.99, so it's an incredible offering for employees or employers to give their employees. And dependents are free, which is a great perk. Our team is super dedicated to this mission. We all come from backgrounds of having gone through different phases of burnout, anxiety, or having used holistic health methods to deal with different chronic conditions. And we all have experience in the direct-to-consumer space, coming from large direct-to-consumer wellness companies, well-being companies. As a direct-to-consumer company, we've had hundreds of thousands of class attendees. We've run over 5,000 classes in the past year. And we have a lot of super users. So we've had people come to upwards of 3 classes on average per day for 6 months. And that's like 600, I don't even know how many, 600 classes in 6 months. So people absolutely love coming to class. We recently closed our seed round, And we're actually looking for, let's see, what's the next slide? Oh, I can see it there. We're looking for a seat extension right now. So if anyone is interested in talking to us about that, we just have a little allocation that we've just freed up. So happy to have that conversation. And that's it. So we would love to take any questions from the audience.
Thank you so much, and you've got them. So I'll start with the first one. It's a fantastic platform. As you think about success for the people you serve and usually for the employers who pay for this, how do you think about that in terms of KPIs, ROI? What do you track personally to make sure that you're on the right track?
That's a great question. We are focused on proving out cost-based ROI as well as patient-reported outcomes, specifically focused on anxiety in our first year. We do offer a lot of support beyond just anxiety and stress and burnout. As I mentioned, we have people coming to the platform for chronic conditions, for back pain. But in early days, really all of our content is emotional health content. So we're focused on proving out ROIs. Based on that, we're running GAD-7 surveys through the platform for all of our members, and we're looking to reduce costs regarding the anxiety as a comorbidity for sure. We also just provide a much more cost-effective solution for people to offer holistic care. So holistic care is a thing that a lot of employers are hearing from employees that the employees want it, but they don't know how to deliver it because a one-on-one session with a holistic healthcare provider will cost $125 on average out of pocket. And the payers can't afford it, the employees can't afford it. And we actually, side note for a second, started as a one-on-one marketplace. And we were actually one of the largest one-on-one marketplaces in the world. We actually sold that part of our company to a large company earlier this year. And what we found with that one-on-one marketplace is that the out-of-pocket costs for direct-to-consumer were basically an impossible thing for people to surmount. So it's actually the reason that we applied for 1501 is we realized we needed to figure out a different format to deliver this holistic content because no one could afford it.
That's fantastic. Yeah. And you guessed my second question. I was going to use executive privilege for the last question today. We've tracked your journey carefully, and that transition from one-on-one support and mentoring and coaching to groups has clearly been part of the success story here. You already answered it, so I won't ask it.
The reason why, my mic gets turned off. The reason why we transitioned to group. So in part, it was to deliver care at a lower, more accessible price point. But actually, we're finding that the group format really does help with people to get started. So booking a one-on-one session with whether it's a holistic therapist, whether it's a nutritionist, whether it's a hypnotherapist, or even trying something like yoga and meditation, can be really scary for people. Like they don't want to they don't want to spend the money because they don't know what they're going to get. But also it can just be really scary. So the group format, especially in the virtual setting, is a really low barrier to entry. So people will try things that they would never have tried otherwise. And then we have kind of a track within the platform to ramp people up into things that they've never tried before. We call it the gateway drugs to wellness.
We will cut that out from the recording. Wonderful. Thank you so much.
Thank you.
Round of applause for Cohort 1.
Awesome. Well, that actually concludes. You've now met our 5 companies for our first cohort of 1501 Health. We are so proud of everything that you've accomplished in the year with us. We're so grateful to all of the advisors who have been a part of that journey, right? As you can see, even just from the last presentation, there's a meaningful difference in thinking about how to leverage the value that Tegan was already creating through WellSet and then package into something that integrates and scales within the really complicated healthcare system. And so really grateful to all the folks who have been a part of that journey so far, and grateful to the people here in this room and also calling in who want to be a part of the journey in the next step, right? We know that we can't be the only people helping startups, that it is truly an ecosystem that is of support, and we're really grateful for people who are interested in connecting with these startups after the fact to learn more about their businesses, to consider partnering with them, to think about investments, et cetera. So thank you so much for being a part of this. And I think just from our perspective, Jordan and I are just so personally grateful to this first cohort. They have been our inaugural cohort. The relationships that they have have formed with each other and supporting each other, and that they have let us be a part of in that journey is just incredibly meaningful, I think, to all of us. So we really deeply appreciate it. And thank you all for coming. So without further ado, for those of you who are virtual, we'll let you go a few minutes early. I can't imagine you'll complain. And for those of you who are in person, please feel free. We've got lunch, and we'd love for you to stick around. If you have any other questions following up from the presentations, please ask them. And thank you so much for coming to meet our companies.
Thanks, everyone.